this hour, we're going to play the plastic surgery true or false game. Dr. Brian Dorner is here this morning, and we're going to talk about some myths about plastic surgery. There's been a whole rise in popularity. There are a bunch of shows on TV about it. Maybe you've seen some of those. We're going to show you what's real, maybe not so real. Coming up in just a few minutes.
All righty. Okay, pop quiz this morning. Do breast implants increase your chance of getting breast cancer? We're going to talk about that and other plastic surgery truths and myths with Dr. Brian Dorner coming up. All right, Adam, thank you. You know, a lot of people have a need. They just want to look good. For many, that means plastic surgery, which is a multi-billion-dollar business. And, of course, now it's spilling over into popular TV shows. Take a look.
I've come up with some new plans for quadricep implants, calf implants, and lat implants.
You devised these?
Yeah, I did them myself.
He's both Frankenstein and Dr. Frankenstein. He's his own creation.
We could turn this into a game, like a social media game, post it up and see who gets more likes.
Now, why are they looking at me like we shouldn't do this?
This is my woman. I love her to death. This is how I met her.
Right.
You're a man, I'm a man to man.
Okay.
Why would you want to go smaller?
It's hard to fake a smile, and it's hard to be supportive when, you know, your mother goes through surgery that she doesn't want to get, and she's doing the surgery because she just wants to get a surgery.
I had seen some girls that had gone to her, and they looked beautiful.
Pumping parties are when you go to someone's residence, but obviously not in a medical office, and have whatever it is injected into your face and your body. You don't know what you're getting.
The result of that was that I had industrial strength silicone, which is really a kind of cement.
Oh my God, beauty is pain.
For real.
Like, this is the ultimate definition. Like, think about it. Waxing, threading, all that hurts, but it looks so good. But when you get plastic surgery, it looks really good.
Yeah, those shows are popular for a reason. Dr. Brian Dorner with Dorner Plastic Surgery is with us this morning. You're going to debunk some plastic surgery myths.
Sure are.
Going to educate us. We're going to play a true and false game. We're going to test out our knowledge. You can play along with us at home.
I'm going to try and stump all of you, okay?
Okay.
It's very easy.
Okay.
We call those Wednesdays.
Yes. So, true or false, breast augmentation is the most requested reconstructive surgery in America in 2016.
I'm going to say true.
You're right.
Yes.
Breast augmentation, 290,000 of them were performed last year.
Wow.
I mean, for women who've been through breast cancer and that kind of thing, it's helping them in their recovery. What about folks who just want it cosmetically?
That number is actually just the cosmetic breast augmentation.
That's just cosmetic.
So, yeah, so reconstruction is actually a lot more because, you know, breast cancer is very common.
Right.
So, and that actually brings us to our next question,
Okay.
which is true or false, do breast implants cause breast cancer?
Oh, that's been controversial
I say
lately.
false.
Yeah, I've heard this for a while. I will go with Jessica. False.
There was a story the other day, wasn't there?
All right, so false is correct.
Yeah.
However, it doesn't cause breast cancer. So breast cancer is very common. It's about 1 in 9 women will get breast cancer. Implants are not associated with that.
Okay.
However, there's been a recent news article about what's called anaplastic large cell lymphoma, which is an extremely rare variant of lymphoma that they've found associated with breast implants. So it's about 1 in 30,000, so it's exceedingly rare, and they're not quite sure what it is, but if you take the implants out, it's cured, and it seems to be only related to texture implants. So we don't really know what it is exactly yet, but there has been some talk about it, but it's not actual breast cancer.
Okay.
So that was a little bit of a trick question there. So.
I have a quick question. What happened, remember back in the day, like maybe the early 90s, when there were all the issues with silicone implants?
Yes,
and then
with
they
the
were
Dow
off the
Corning.
market for a while. But they're back on, right? They're safe now? Is
Correct. Unfortunately, that was a giant scare, and we don't want to have that happen with what's going on right now. Like, the FDA doesn't recommend women to have their implants removed. You want to do your routine surveillance. You know, you want to get mammograms. You want to do your physical exams. And, you know, if you have some swelling or other things, you want to go back and see your plastic surgeon to look for that ALCL. But there was no real health effects of the old implants, but it was just like a big media scare,
Gotcha.
and then they had a big lawsuit, and before they could prove that implants were safe, that Dow Corning had already gone out of business, and it was just a big debacle. So hopefully, you know, people realize that they're very safe implants. They're actually the most studied implantable device in the world, which is kind of crazy for just a plain breast implant, you'd expect a defibrillator to probably have
Something-
more
yeah.
studies, you know, that shocks your heart. So.
All right, question
Try it
3.
again.
Okay, so number 3, true or false, Americans spent $30 billion on cosmetic treatments in 2016.
$30 billion.
I'm gonna go with true.
I'll go with true.
Yeah.
I actually think it might be more.
You think?
Well, should have just gone with false, because otherwise you'd been right. It's actually less. It's 16 billion.
Oh.
That's still a lot.
It is a lot. Let me throw in another one that I just ran into. So this is an extra one. So true or false, Botox is the most expensive substance on the planet.
That sounds like a trick question.
I'm going to say false.
I'm gonna go with true.
True.
True. Incorrect. It is worth about $1 trillion a gram. But if you look at antimatter, if you have a gram of antimatter,
Okay,
it's
all right.
$62.7 trillion
So
a
Thank
gram.
you.
right.
it is
It's
only
right.
less expensive than producing antimatter.
Exactly.
Commander Spock over here.
So I thought that was an interesting one. The most popular minimally invasive procedure are anti-wrinkle treatments.
True or false?
True. I'm going to
True or
say
false?
true.
So that would be
Hands down
things like
true.
Botox.
Correct, yes.
So, yeah.
Yep, absolutely, it's true. So 7 million of those were performed last year. The next runner-up was fillers, which was 2 million. So it's a very, very common procedure.
What's really the difference between the two?
The-
They're both injections, right?
Correct. So Botox actually affects the muscles, which reduces wrinkling, whereas fillers give you volume. So they're used in different applications, but they both reduce wrinkles. So sometimes there's some confusion in it. But Botox is really for wrinkles. Fillers are really to fill.
Okay.
But they can be used kind of interchangeably.
Do you ever have to turn patients away who are just completely overdone?
Oh yeah, and it's almost like a branding image for some of these people. It's almost like a Louis Vuitton purse. I swear some people want to get all this
Yeah.
weird stuff done, so when they walk around, people are like, oh, they've had plastic surgery. I don't really like that. I turn a lot of people away that come in and they're like, you know, I need this, I need that, and they're just not in a good place.
I've read that, like a lot of women, I mean, some men too, will overfill, over Botox, so that they think it has a look of wealth and money.
Right, exactly.
status symbol.
Yeah.
Yes, and that's the only thing I can come up with why people would want to look that way. I mean, some
Right.
of those pictures from Box are crazy.
Well, when you see those pictures on Botched, and you see, I mean, these are colleagues who are actually making these things happen. What do you think about what you see there?
Well, it's a sort of a sad state of affairs for all of medicine. So as they've sort of driven down reimbursement for standard medical care, everybody's getting into this market. So everybody wants to have the cash market. So you have ER doctors. I just saw a radiologist that's doing breast implants in Ohio. And, you know, just kind of crazy things going on. And as you do that, people who really don't have any interest in doing a good job, they just want the money. You know, if you
Right.
come in and you're going to give me money and that's all you want out of your practice, you're going to do it. So somebody like that from Botch comes in, then they don't need anything more. They really should stop. They get it because somebody's willing to give it to them. It's really kind of sad and disgusting in my opinion, but it's the state of affairs in American medicine right now.
We have one more question.
Yes, we do. True or false?
Who's winning?
Me. Not that I'm keeping score, it's me.
Reconstruction surgery for men is on the rise. This is a testosterone
True.
question.
Totally true.
Oh, absolutely. So pec implants went up 208%, and typical plastic surgery is up 29% for men. It is one of the fastest growing segments of plastic surgery right now.
Pec implants, a lot of men like calf, they go for the calf
Calf implants are very
too.
common too, yes.
Yeah.
So, you know, kind of bulk up without having to.
What's the number one thing you see at your practice?
Well, for men, it's clearly male breast reduction. So
Okay.
it's just liposuction or removing, you know, gross that people don't want.
Is that after like a weight loss surgery they come in?
Well, weight loss or sometimes some medications you're on can cause male breast growth. You know, sometimes just weight gain or loss will do it. So removing that, because it's embarrassing for men. A lot of times, you know, they won't take off their t-shirt or something like that. So that's the most common. Liposuction and rhinoplasty are extremely common too.
Wow.
Dr.
Yeah.
Brian Dorner.
Thank you.
So you
Very
won.
insightful.
Congratulations.
Thank you.
Yes.
I don't know. I don't get a prize or anything. I can gloat. at
Our
least.
respect for once.
For one
Right,
time.
Only for the hour. Only for the hour.
All right. Well, Cameron is having fun this morning, too. He's checking out Kindred Beers as part of Columbus Craft Beer Week. We're going to check back in with him right after this.
Got me